Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Dr. Nita Valens.
Hi there, Dr. Darrow.
Hello, Nita Valens. How are you today?
I'm great. And yourself?
I'm living it up. What about you?
I'm living it up right there with you. I sure am. And we want our listeners to live it up. So how are you going to do that if you're in pain? Well, we have answers for that today. So if you're suffering from muscle pain, joint pain, ligament pain, tendon pain, tendonitis, stiff joints, dull aches, basically any kind of orthopedic pain, you want to call the program all hour and speak directly with Dr. Darrow at 866-870-5752. Our number here at the station again is 866-870-5752. And we're going to be giving you a free book when you phone the station today. Dr. Darrow's latest. It is called Stem Cell and Platelet Therapy. Regenerate, Don't Operate. It has 264 studies. The foreword is written by the lovely Suzanne Summers. And this is your gift for calling the program today. Again, the number is 866-870-5752. And please check Dr. Darrow's website at www.lastemcells.com. That's www.lastemcells.com. You can email him off of every page on the site, and you can watch him performing these treatments on video that you're going to learn about today. And we are here Saturdays at 10 a.m. and again at 1 p.m. That's every Saturday. So what do you think, Dr. Darrow?
Well, I think I'd like to start with a question that just came in. It's a very moving question.
Okay.
A little complex, but it'll give me a lot to talk about in terms of how I can regenerate the body using your platelets from your blood or stem cells. And it starts off like this. I am a 63-year-old male, very athletic, physically active, in excellent physical shape except for my spine. I live with a great deal of pain, mostly lumbar and thoracic. Cervical is the neck, so everything below that it looks like. But also have a pinched nerve in my cervical spine that causes numbness in my right arm, not allowing me to play my musical instrument. About 35 years ago, I had a hip surgery, and the surgeon shortened my left leg by 3/4 of an inch. That wasn't done purposely, by the way. That's just something that happens when hip surgeries or knee surgeries are done. Very often it happens. Some surgeons believe this has been the root of my spine issues, so we see that very commonly. Someone will get a surgery on their hip or their knee, and then their back starts hurting afterwards. Anyway, I get RFAs, that's radiation to the nerves, to actually, in a sense, kill them. I get nerve blockages, epidurals like clockwork every time the time limit allows. Well, what's that time limit? Doctors will say you can have these big steroid doses 3 times a year, but it's not good for you to get a big steroid in your system. We have some people that come in that have adrenal problems because of it, because the steroid will shoot up their cortisol. Women get problems with their periods. So there's a lot of issues from the epidurals. It's not just like go in and do it and then walk out and feel great. He then says, in addition to not wanting to stop skiing, surfing, playing guitar, etc., this constant pain is affecting my mood, well, I bet it is, and can make me quite miserable. My current surgeon is ready to give me the surgical procedure ACDF That's removal of a disc in the neck in the anterior portion. They go in through the front of the neck. That should allow me to play my guitar, but no surgeon wants to operate on my lumbar spine, which is 98% the source of my agony, misery, etc. What do you think? Well, I have a lot of thoughts. We could do a whole show just on this question. First of all, this guy is pretty active, which is great news. It means that whatever these things are that the surgeons are thinking they want to operate on probably don't need to be done. So the numbness in the right arm, often that is a result, or if there's numbness or tingling or pain in the leg, arm or leg, of the spine being out of alignment. So that can be helped by aligning the body. Sometimes it can be not from the neck or the low back. If it's a pinch of a nerve in the neck, it'll go down the arms. If it's in the lumbar or the lower spine, it'll be from a pinch in the nerves there sometimes. But often it's from something lower down. It can be from the elbow, it can be from the wrist, it can be from the hip, it can be from the knee. So we have to be very careful not to operate on something that shouldn't be operated on. That's lesson number 1. Number 2 here, the person that has back pain doesn't necessarily have to have surgery on the back to get rid of back pain. We've been talking about this on this radio show for 20 years. I've been doing this work for about 22 years. We can often find the spot in the neck or the low back or in sometimes the thoracic spine that is causing the pain. Inject that with your own cells, meaning platelets or stem cells, and heal that up. No surgery needed. I have to examine the person with my hands, move them around. If you come in the office and I touch your neck or back, I can usually tell you in about literally 10 seconds whether I can help you or whether surgery may be the answer. It's very rare that surgery really is the answer. And I'm sorry, this is not a statement against the surgeons. Everybody who listens to my show knows I love surgeons. I was on path to become a surgeon until I had a shoulder surgery by my professor in medical school, my 4th year medical school, that totally jacked my shoulder. It took me a few years to find out about regenerative medicine, at which point I injected my own right shoulder. I got in bed with my wife. She was watching TV. I pulled out a syringe. I injected myself. She was not happy about that. She was throwing some expletives my way. Nevertheless, I told her this is something that had worked on my wrist, and I wanted to try it on my shoulder. And I woke up the next morning completely healed. Completely, at full range of motion and no pain. That lasted for 12 years until I re-injured it. Different injury. The next time, instead of 1 treatment of regenerative medicine, it took me 2 treatments, and I was completely healed for many, many, many years after that. Okay? Now, it doesn't always work that quick, because I had a 3rd injury in those 20-year periods. And the 3rd time, it took a few months to get that shoulder healed. I'm being videoed right at the second. I'm waving my right arm up in the air to let you know that I have 0 shoulder pain in either shoulder. And both of my shoulders have been locked up. I had frozen shoulder, what we call adhesive capsulitis. I'm perfect now. Why? Because I don't get surgery anymore. Had I not known what I know about the work I do, I probably would have had 10 different surgeries. Unfortunately, in my book, there's a lot of studies that show that these surgeries fail quite a bit of the time. I don't blame the surgeons for it. It's just what happens. So I know a lot of you listening have had failed surgeries. I have failed surgeries walk into my office or hobble in all the time, and it's a shame. So I'm not saying there's no place for surgery. There is. But most of these surgeries should not be done. There are studies after studies on knee surgeries where they compare. They take someone, let's say, with a meniscal tear in their knee, they've got pain. And they do a fake surgery. Fake means they cut the skin, they don't get inside the knee, and they suture it up or staple it up. And that person thinks they had a surgery, right? Against someone who really had a surgery. That's the comparison in the study. And the ones with the real surgery do the same as the ones without the surgery, with the fake surgery. What does that tell you? Nita, I'm going to let you guess.
Well, it says that a lot of those surgeries just aren't effective.
That's right. You don't need them. And that's all over the body. We get people that come in. I get people with shoulder replacements all the time where they're worse than when they started. Knee replacements, hip replacements, arthroscopic surgeries. People come in and say, Doc, all it was an arthroscopic surgery. They made 3 little holes. Why did that hurt me? It doesn't matter if it's little or big. These surgeries, for the most part, should not be done. That's my opinion. I'm entitled to it. I'm sure if I had a surgeon on the show, we'd have a good dispute about that. Because they believe what they do is right. And I can't change their belief systems. I do send many of my patients to surgeons for a second opinion. And we always hear the same thing. We need to get this guy into surgery. Well, guess what? We don't do that. We tell the person that they could do that if they want to. It's up to them. But we certainly should try regenerative medicine using platelets or stem cells in most of these cases. And in most of the cases, we heal the people up. So that's just the way it is. So this person that wrote this question, I would certainly find it's not a person in the LA area. I'm looking at the area code on the phone. But I would Google, find someone in your neighborhood who does this kind of work. Just look up regenerative medicine, put your city in it. And when you find someone, call them up and say, how many of these procedures did you do today? Because most people advertising to do this work honestly don't know what they're doing either. You've got to do something in medicine. I always tell my patients, I don't care if you're getting something for your liver, your kidneys, your neck, your back, your heart. Go to the doctor that does the most. Always go to the doctor who does the most, who has the most experience. I think that's me. I think I do the most of anybody in the country. Check it out. Call me. Ask how many I've done that day or that week or that month.
Well, he could fly in to see you. He could just fly in or drive.
True.
Because
that's true.
You might be one of the people that's done more than anybody even across state lines, really.
Well, I think more than anybody in the country and probably in the world, but I'm not sure of that. I'm told that when I go to national meetings. There are docs who come up to me and go, you do more in one day than I do in a month. So be careful who you go to. Just because someone has gone to a weekend seminar doesn't mean they're competent in doing this. Make sure if you're getting a knee, shoulder, hip injected, some of the other joints, you absolutely need to have an ultrasound to guide that needle, or there's about a 33% chance that the solution will not even go into the affected area or get into the joint. Blind injections are fine in some areas, low backs, necks, whatever, but some injections have to be done under ultrasound guidance in order to get to the proper area. So I'm going to give out my phone number and get some calls to the show. So if you want to talk to me live right now, the phone number to the studio, get your pencils and your paper. If you're driving, please pull off to the side of the road, get off of your Bluetooth so we can hear each other. But the number to the studio right now is 866-870-5752. I would love to speak to you. That's funny. As soon as I said that, the phones are starting to light up.
I love it.
Again, the phone number is 866-870-5752. And I have another phone number for you, which is my office. There are people waiting by the phones right now to get your information and give you more detailed information than I can give you over the radio. And the phone number to the office is 800-300-9300. I'm going to repeat it. It's 800-300-9300. And for those of you on a computer, you can go to my website and email me from there. It's www.lastemcells.com, www.lastemcells.com. And actually the phone that's lighting up the most is my cell phone.
Oh, that's hilarious.
It's being bombed right now.
That's funny.
But to get to the studio right now, that's the best way to talk to me live. Please call me at 866-870-5752. And we do have Sergio waiting right now. So, Nita, do you mind if I talk to Sergio about his shoulder?
Let's do it.
Sergio, can you hear me? This is Dr. Marc Darrow. Good. And how long has your shoulder been... Yeah, perfectly. How long has your shoulder been bothering you for?
It's been on and off for about, I'd say, a year to 2 years.
Okay. Is it your dominant arm, your right arm in most people, or your left? It's your right arm. Okay, and that's your dominant arm. And did you hurt it doing sports or lifting or something else?
You know, the initial pain started in the incline lifts, and I'd kind of work around it, and then it'd go away, or I'd shift my position in my hands, and then it would make it less acute, you know. And then the COVID started, and I stopped going to the gym completely, and I thought, finally I'll let this time kind of heal my body, not going to the gym anymore. And it got actually worse. So I had major muscle
common.
loss, and it got worse.
Yeah. Okay. So everything that's happened to you is common. It's normal. It's unfortunate, and it's generally easy to fix. I'd have to touch the areas to see where the pain is being generated from. How is your range of motion? Can you lift your right arm all the way up in the air, or is it blocked?
Oh, yeah. My range is all there. It's just different levels of pain depending on where I'm going with it.
Okay, good. So I have a couple of keys for you and everybody else listening to the show that are real important for shoulder health. Number one, make sure you maintain your range of motion so your arm can go just about straight up in the air. And the way you do that, I use a golf club, and I do it every day. I have golf clubs in every room in my office. Every treatment room has a golf club. And we don't use it necessarily to train golfers, but we use it to show people with shoulder pain how to stretch their arm out. And what you do is you hold one end of it in your hand. In this case, it's your right hand. That's your affected shoulder. And the other hand on the other end, and you push your arm gently, slowly up into the air. If you don't have the range of motion, stretch into that part that's painful. Don't hurt it too hard. And then hold it there for about 2 minutes, and do that twice a day. Do it on both shoulders. People that are working out need to stretch their shoulders every day. I also do it on a door jamb. I'll put my fingers up over the door jamb and just kind of wiggle around to get that range of motion in every position. Another thing is when you're lifting weights with your shoulders bothering you, even if it's not bothering you, or doing push-ups or bench presses, things of that nature, make sure that your hands are not wider than your shoulder. Now that's how I did my first shoulder injury. I had a trainer, this is back in Hawaii, I was in pre-med, and the person said, you're kind of round-shouldered, you need to get your lateral pectoralis muscles hypertrophied. So it was actually a woman. She had me stretch my arms out so I got the lateral pecs. And it stretched my shoulders backwards too far, and the shoulders don't like that. I ended up getting a shoulder surgery for that failed, miserably failed, one of the worst surgeries that I've ever had. So I now stay away from surgeries. I've been able to heal everything on my body by just injecting myself, and it's something that works most of the time. It's not going to work on everybody, And the reasons that PRP or platelet-rich plasma or stem cells typically don't work is because people quit too soon. They say, well, I went to my orthopedic surgeon. He says what you do is nonsense. Well, it might be nonsense, but it sure works most of the time. It's nonsense to the surgeon because they don't do it. And the surgeons that do these procedures really don't believe in regenerative medicine. They know how to do it, but they don't know how to do it the right way. They'll inject a shoulder with one injection, and that's not the way to do it. That will fail. I just did a shoulder yesterday afternoon, and I counted 25 injections in one shoulder because we never know where the pain generator is. So I injected the joint, I injected the labrum, I injected the subdeltoid bursa, I injected all 4 of the rotator cuff tendons. So I think we can help you, Sergio, but you're going to have to come in. The office phone number, if you want to make an appointment, is 800-300-9300. I'm going to repeat it. Grab your pencils, everybody. It's 800-300-9300. And again, if you want to call me and talk to me live right now on the show, the phone number here is 866-870-5752. That's on KRLA, 870 AM. And that's 866-870-5752. Sergio, do you have any other questions about your shoulder?
No, that'd be great. I'm going to make a call, make an appointment, because I'd really like to see you.
Well, I'd love to meet you too, and I think we can heal you up. But it doesn't sound like there's anything terrible going on. Okay?
Yeah. I hope not.
I don't think so.
Excellent.
I mean, you have range of motion.
Yeah, absolutely.
All right, man. God bless you. Thank you so much for calling.
Appreciate it.
Thanks for your call, Sergio. Bye. That number here at the studio again is 866-870-5752. That's 866-870-5752. We have lines open for you right now. And check out Dr. Darrow's website at www.lastemcells.com. That's www.lastemcells.com. You can email Dr. Darrow off of every page on the site, and you can watch him performing the treatments on videos. Very exciting stuff. And remember, you get a free book when you call the show today. It's called Stem Cell and Platelet Therapy, subtitled Regenerate, Don't Operate, and it has 264 scientific studies. So there. What do you think?
Beautiful. I have another case that actually came in yesterday. A wonderful gentleman drove up from San Diego, and he had a labral tear. Labrum means lip in Latin. I was lucky to have taken 4 years of Latin in high school. It's funny. A great language. I mean, a lot of our English words obviously are from Latin, and the Romance languages, Italian and French and Spanish have a lot of Latin roots in them. So the labrum, which we have a nice big labrum in the lip, and it kind of holds the hip bone or the femur in place, and then the shoulder has a labrum also. And we can inject those when they're torn under ultrasound guidance. We can see those teeny little tears and fill them up with platelets or stem cells to help them heal. So I had a young gentleman come in, and I looked at his x-ray, had a labral repair, but I saw metal from his hip down to his knee, and I said, well, what was that for? And then I noticed that the bone, the femur, had been cut, surgically cut, and he said I had an osteotomy. That's where the bone is cut. And he said that would help with the labral tear. Now, I don't ever put down surgeons because I love surgeons, and they, to me, are really like the gods of medicine. Hang with us, and I'll continue what I was just saying.
Okay. You're listening to Living Pain-Free with Dr. Marc Darrow. Our call-in number here at the studio is 866-870-5752. Lines are open for you. We're going to take a brief break. Be right back. I'm your host, Nita Valens. Stay tuned.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.